of you are working. Some of you have other things to do. So I'm really happy that you're here. Let's get started. Sorry, 1 second, guys. There's something in the middle of my screen. Got it. I said, okay, good. So I'm a licensed naturopathic medical doctor. My clinic is in Pasadena, California. I'm not too far from the Pasadena cancer community. A couple of blocks away, you can even walk to my office. We're located on a corner of Del Mar and Fair Oaks. I specialize in naturopathic oncology, and I offer complementary therapies. This is a really important point here to mention, because I get a lot of patients coming in asking about what I can do for their cancer. So complementary therapies is just what I offer. You have to have an oncologist on board, and I help along with the oncologist to make sure your body comes back to balance, whether it's nutritional deficiencies you may have or any additional support your body will need. This is where I come in. I'm also a general practitioner, and I see a wide range of conditions, and I treat patients of all ages. So sometimes you can bring your children or, your family members, all of them. I don't discriminate. I can see them all. So let's see. I just wanted to give you a highlight of what therapies we offer in our clinic. So a lot of times labs can also be challenging where you're going to a clinic because you have to be sent out. We do them in-house. We take your blood and send in for analysis, and we can use Quest or LabCorp or Primex or even specialized labs that may be out of pocket if they're not FDA approved. So we do it all. IV therapies, those vary. It could be nutraceutical support. It can also be geared for cancer. So it could be oxidative therapies and such. For example, high dose vitamin C or curcumin or resveratrol or EGCG. So different types of therapies are offered here. Hyperthermia therapies, we have local hyperthermia or hyperthermia ozone sauna therapy in our office. Pain management that comes, prolozone therapies they're basically injections to help with pain. And of course, oral support, anti-inflammatories could be helpful. Ozonotherapies, I'm really big on IV ozone therapy or different delivery of ozone therapy for infections or cancer or to boost your immune function. We can talk about those things in person, or if you have questions at the end, I can answer them. Peptide therapies are new in my practice. This is kind of cutting edge medicine. Our body makes peptides, and now peptide therapies have come into play in both conventional and allopath and non-conventional clinics, and they're extremely useful for immune support or wound healing, or in some clinics they're used for weight loss. So there are different types of peptides. We can talk about that later also. Diet and lifestyle modifications, this is really big. This should be a big part of your interest battling with cancer, because this is something you can do on your own, kind of take control of your health. Hyperbaric oxygen chamber, it's at the bottom of the screen. If you see it, it looks like something from NASA, and that's exactly what it is. Divers used to use it. It's pressurized oxygen to breathe and increase oxygen in the blood concentration. Also, pulse electromagnetic therapy. Pulse electromagnetic therapy is extremely useful in healing wounds and lowering inflammation. So for pain management, it comes very handy. So these are different therapies offered at the clinic. I do want to say that I'm the only medical doctor at the clinic currently, but we do have great supportive staff that are extremely helpful. We have one nurse, a medical assistant, and a couple of front office desk staff that are great. And I always like to give a shout out to them because they really do a great job supporting. Let's kind of dive into what your interest is tonight. Cancer, some known causes of cancer. You may or may not have heard about these. smoking is a very common one, but formaldehyde exposure, UV radiation, that could be from radiation equipment. Sometimes our cell phones can now be emitting radiation, or sun exposure, high temperature cooked or charred meats. Glyphosates are really big in this new century. Monsanto has been spraying Roundup in the soil and vegetation, and our farm industry has saturated with glyphosates, and glyphosates are causing cancer. You may have also seen on TV now for lymphomas and leukemias, they're talking about if you've had Roundup exposure and you've got these cancers, you could be, I think, in a mass action lawsuit now. They're all over. I mean, you might have seen these ads, so this is something very prevalent. Asbestos, hormone imbalances, viral infections. Viral infections are huge. Epstein-Barr, cytomegalovirus, these aren't usually screened with conventional doctors, but should you have had viral infections in the past, they can cause havoc in your DNA, changing the DNA function, and then eventually over the years developing cancer. Now that you have cancer, what can you do? This is one of the most important part of treatment, therapeutic practice you can have in your life, physical activity and exercise. We talk about this a lot. You hear it everywhere. It's funny. It's something that we can all do on our own, but we do less of, but it's extremely important. And I wanted to list here the importance of physical activity. It can lower the risk of your primary diagnoses. It reduces your BMI, and that can solve a lot of problems. Reducing BMI can balance your blood insulin levels, sugar levels, boost your self-esteem, increase health benefits. It lowers inflammation, so pain can reduce just by losing the weight from physical activity. Balances hormones, improves immune system function, enhances quality of life, improves cognition, improves sleep. I mean, the list is endless, and exercise will be mentioned in multiple times throughout my slides, just to emphasize that sometimes repetition can really have a profound effect on you where you make these changes in life. Types of exercises and duration. I wrote these down because these are very commonly asked, and I really broke down how many minutes a day really adds up to these numbers. So 150 minutes a week really boils down to just 21 minutes a day. So this is moderate aerobic exercises. If you choose to walk, it's just walking fast enough. I always say if you're on a cell phone, you would have a hard time saying your words and catching your breath at the same time. That's the type of intensity you want to do for the therapeutic effects. Or 75 minutes a week, which really boils down to 11 minutes daily of, again, vigorous aerobic exercises, plus 2 days a week of resistance training. I always say if you can, I see someone stretching in the screen, which is great. I like that. I always say if you can carry your bags from your grocery store and instead of having someone do it, that could be a form of resistance training. Just think about those things, be mindful. If you're going to pick up a box, of course, you want to be careful, but it is a sense of resistance training because you're increasing that weight and helping your bone strength. Goals of exercise. In the bottom of the screen here, I wrote down the website where you can actually find this a BMI calculator, and it's really easy to use. All you need to do is plug in your height, which is your in feet and inches, and then your weight, and it'll calculate and spit out your BMI here. And I wrote down what would be an ideal BMI for all of us. So 18.5 to 25 would be an ideal BMI. And that's kind of your goal, what you're shooting for. Instead of looking at numbers in pounds, you want to kind of look at that, and I'll give you a good range of where you should be. And it's easy to kind of get past or be under, even underweight would be an issue with cancer diagnoses. I get a lot of patients that are asking about how they can gain the weight, and we'll talk about cachexia and some of the therapies for that later in the slides, but more importantly, it's the excess weight that's very important to actually bring back to balance, because that helps reducing insulin. And we'll talk about later in the slides again that cancer cells or tumor cells have insulin growth factor receptors, IGF-1 receptors, and with having with being overweight, you're actually increasing that insulin production in your blood, expediting the rapid growth of cancer cells. And we don't want that. We want the opposite. So we're going to talk about nutrition. It is extremely important to focus on health promoting diet and lifestyle changes. This is something that's not talked about by conventional medicine. It is now, it's starting to change. I'm seeing the shift now over the years, but even still, I hear doctors saying you can eat anything you want. Food had nothing to do with it, and it's not true. It's not true. There's plenty of research supporting this. So we're going to talk a lot about nutrition, lifestyle. So reducing calories, increasing exercise to improve your BMI. This is one way you can get the BMI to be ideal. Reducing refined sugars, refined flour, red and processed meat. And we'll talk about, again, why red meat, even though red meat has its benefits, and in ketogenic or protein-rich diets, red meat becomes a staple of some people's diet. We have to focus on grass-fed, clean, organic red meat. So you're not eating, you're not consuming the health problems that the animal had. This is very important because you're now incorporating those health issues the animal had back into your body. For example, if they have increased hormone, or if they've been corn-fed and they didn't necessarily have nutrient-dense meat and you're eating that, you're really not getting anything from that. Reduce, eliminate trans fats. This is very important. Trans fats can actually alter your DNA and cause problems. Reduce high salt foods. Avoid food chemicals, coloring, flavorings, preservatives. Reading the labels, very important. Increase fruits and vegetables, increase whole grains, include essential fatty acids, incorporate herbs and spices into your diet. I'll give a few dietary choices. We'll talk about Mediterranean diet as one, pesco-vegetarian diet is another one that could be really helpful in cancer. But a few of these food groups will be mentioned over and over again. The foods, the vegetables, whole grains, fatty acids, herbs, spices, they'll just keep coming up. And it's good to repeat them because this is really important. This should be the staple of your diet. I get this question all the time. I'm afraid to eat. I hear all the time, I don't know what to eat. So eating a good, wholesome diet is really important. And every time you put food in your mouth, you want to think about whether that's going to give you just empty calories, or is it going to give you nutrition? Or even worse, is it going to give me anything that's going to increase inflammation and make me sicker? So, and then this website, let me go back. Sorry about that. EWG.org. I've talked about this website in my previous presentations. I can't emphasize the usefulness of this website. It really should be your Bible, learning about your health going on this website. This is our government actually funds this website, and it talks about herbicides, pesticides, what fish, what chemicals are in our beauty products, where to shop. I mean, all kinds of information that's being updated almost monthly and daily basis that you can have access to. So for example, I hear, well, but it's high in mercury, should I eat fish? You can go on there and see which fish during the season or tides will be lower in mercury, and then choose those, for example. So this is a good website to use. And the Dirty Dozen is extremely important to kind of to maybe take a picture of the screen, have in your phone when you're shopping, because foods that are in this group on the left, where it says dirty dozen, those are the foods you want to eat organic, because they're so heavily sprayed with herbicides and pesticides. Those are foods you definitely want to eat organic if you can't afford to have all foods organic, which that would be ideal for all of us. And then on the right side here, the clean 15, these are foods that are safer to eat if they're not organic. And this list becomes more important, this on the right side becomes more important when you're eating out. If you're out at a restaurant, you almost can't trust that food's always going to be organic. So if you're going to be having an avocado, for example, versus a strawberry, you know that you're safe eating that, whether it's organic or not, when you're eating out, versus a strawberry that you're not sure about, you know? Okay, let's see. How many servings do we need per day? So as you can see, vegetables are higher in servings than fruits, because the fruits, although they have a great amount of nutrient content in them, they also have sugar that's high, and that's why vegetables would be more preferred than fruits. But that doesn't mean you shouldn't be having fruits, because it's got beneficial fiber, beneficial vitamins, it's got proanthocyanins. All the different colors of fruits give you all the benefits that you need. Proteins and beans are the next higher ones in the group, or in seeds and nuts. Healthy oils are very important. Seeds and nuts become very important also. I'm so sorry, I should have turned off the phones. Hang on one second. Sorry about that. Sorry about that. Oh gosh, hang on one second. Let's see if I can forward the calls. Just a second. Okay, that way it won't ring anymore. I apologize for the interruption there. And carbohydrates, whole grains. Oh gosh, again, huh? Carbohydrates, whole grains. You want to eat less of those, because even though they have benefits, they do have vitamins in them. They're higher in calories. So anytime you're fixing your plate with your proteins, carbohydrates, your nuts and seeds, vegetables and fruits, you kind of want to keep the serving sizes in mind when you're putting your plates together. And this is where this page can become handy. And then on the next page here, I actually talk about what the serving size looks like. I've had this question asked so many times in the past that I wanted to include this slide in here. So one serving size would be a cup of raw leafy vegetables, or half a cup of raw non-leafy vegetables, and so on. So this is really a good resource for you to have. It's self-explanatory. I'm not going to spend too much time here. What foods to avoid. Again, some information will be repeated only because it's so important. Sugar has to be either avoided or really reduced from your diet, especially simple carbohydrates, and that would be just table sugar. It would be sugar contents and drinks. You want to consume your sugar from fruits and vegetables. That's how you want that to happen. A little bit of honey is okay. Let's see. Stevia, I think, is okay, but if you don't need to flavor it, then don't do it. Skip it if you can. And food allergies, I want to talk about this. Cancer is a high inflammation, low immune system condition, and you want to lower an inflammatory state in your body. So food allergies can cause inflammation. They can increase your immunoglobulins against certain foods, triggering an inflammatory condition. Some people will also have what's called a mast cell activation. They're just, reacting to a lot of different foods, and they're always having to take antihistamine medications. So you want to avoid that. One way I can help here in this group is doing a food sensitivity panel. And this panel includes a dairy group, fish, shellfish, meat, herbs, spices, fruits, vegetables. It's pretty inclusive, and also dietary fats. And it takes about 3 weeks for the results to come in. It's a simple blood draw. And based on the findings, you'll learn what foods to eliminate from your diet and what foods you can incorporate and eat. That way you're not guessing or saying, I don't know what caused the abdominal bloating. I don't know why I'm not feeling well. All of a sudden, I feel so tired. Food should give you energy, shouldn't make you fatigued. You really shouldn't slow down so much. I understand after eating food, you want to digest your food. So, just sitting down, enjoying your food and spending a little bit of time after should be enough. You shouldn't be going to sleep. And I do hear from patients saying, I feel like I'm in comatose state after a meal, or food coma is a term that's often used and it shouldn't happen. That means you're reacting to certain foods. Another one is dairy. Irregular dairy is an inflammatory food, and you want to avoid that. Avoid this group of food. So we get a lot of our dairy from cows, and cows, if they're hormone fed or if they're actually being treated with steroids because they have to constantly be milked, we're consuming that. And you want to avoid that for this reason. Dairy today versus dairy 60 or 70 years ago is very different. So we want to avoid that food. Refined carbohydrates. Again, I can't emphasize this enough. This includes a bag of chips also, not just pasta. And that's a very common one. It's fun to eat, it's crunchy, but you want to think about that. There are a lot of good alternatives now instead of regular potato chips that you can consume as far as refined carbs if you need to. Sodium, you want to reduce salt as much as possible. And this becomes an issue when you're eating out. If you're preparing food at home, I can't imagine you're adding that much salt compared to when you're eating out, or if you're eating already ready to go processed food. Fast food is very common to have really high sodium, so avoid that. MSG is another one. You'll find MSG in a lot of Asian foods, although Asian food could be very delicious. You want to avoid it unless you cook it yourself. I always, when I'm eating out, I'll say I actually can get anaphylactic, life-threatening allergy to MSG. And then that's when the truth comes out. They'll say, oh yeah, it's true, it does have MSG, you shouldn't eat it. Otherwise, a lot of times they'll just shunt you away and say, no, there's no MSG in the food. So be mindful about that. It's a neurotoxin. It can cause swelling and cause brain fog, and it can increase anxiety. And and with cancer, anxiety is kind of anxiety and depression naturally comes along with this diagnosis because there's so many unanswered questions that cause anxiety alone. You don't want to induce any more from food. Alcohol is another one. I do hear a lot of patients asking if they can have a glass of wine here and there. If you're having maybe a glass of wine once a week, it's not the end of the world, but it is blocking detox pathways. And keeping that the detoxification pathways is extremely important, especially for patients that are undergoing chemotherapy. You want to help the liver, not hurt the liver. Xenoestrogens, BPA. BPA is plastic, so I always encourage all my patients or my loved ones to avoid plastic Tupperwares. That's a very common one. Plastic bottles. So invest in a good canteen or glass containers, and get rid of all plastic. You don't need it. Okay, let's see. So this page is talking about saturated unhealthy fats and trans fats. This is the big one, margarine. You want to be careful in restaurants, especially when you're getting bread and butter, for example. A lot of times it's not butter. It could be margarine. It's easy to spread, easy to store. It's cheaper than butter. So it's still commonly used. Be mindful about it. Ask and try to avoid it altogether because you can't digest it. It actually slows down metabolic activity. You don't want that. You don't want that kind of inflammation in your body. Hydrogenated fats. These are fats that can directly damage DNA. And I've put this picture here because a lot of fast foods still have hydrogenated or trans fats. So be mindful about that. Let's see. Ideal diet for cancer. This is a common question. The two most popular diets that are consistently around for cancer are pesco-vegetarian, which is a lot of fish, less red meat, And the next one is a Mediterranean diet. They both have this sense of wholesome diet where you're getting a variety, right? You get the fatty acids, which you're getting from seafood, the plants, the fruits, the vegetables, the spices, and you're reducing a lot of the processed stuff in the food. So this is one of them. And then the other one is the Mediterranean diet based. This is best scientific evidence for a lot of conditions, including cancer. So lots of fresh vegetables, olive oil is a staple of the fatty acids here, seafood, whole grains, seeds, legumes. You can use some poultry, but they have to be organic. I mean, I didn't talk about the ketogenic diet in my presentation this time. I did put a lot of effort on it a couple of years ago. I'm not going to say it's a fad diet. There's a lot of good research supporting ketogenic diet in cancer. The only issue with ketogenic diet is it's not sustainable long-term because it will cause nutrition deficiencies. After a few months, you need to start taking a lot of supplements just for the diet alone. And with cancer diagnoses already, the medications and the supplements on their own to support this condition is plenty. And to increase more supplements for supporting the diet, it's kind of redundant. So that's one thing. That's one of the reasons why I'm not only motivating patients to be on a keto diet. Specific cancer conditions, ketogenic diet is the diet, especially for brain cancers. And then, but now with that being said, Mediterranean diet and the pesco-vegetarian diet are up there because they still have low sugar. The ketogenic diet has almost no sugar, right? It's 10% carb, 20% protein, and then there's 70% fat. But like I said, it's not sustainable. So I'm not a big fan of it. If patients are up for it, I will support it. But if you were to ask my recommendation, these would be the two common ones that I would recommend. And what to eat, alkalizing diet. So I've heard a lot of questions about alkaline water. This is how you want to reduce the acidity in your body and increase alkalinity, is through the diet, not necessarily through the water. So reduce acid forming meat, sugar, salt, increase alkaline plant foods, vegetables, berries. So I kind of wrote down some of the list of foods that can help alkalinize your body's fluids, neutralize you more than make you acidic or even alkaline. The idea is not for you to be alkaline. The idea is to alkalinize the acidity in your body. So these are some of the foods that could be very helpful. I do want to mention soy here in the bottom and the legumes. That's a controversial one, especially for breast cancer. There are a lot of therapists that will frown upon soy. If it's non-GMO and it's not processed and it's organic, soy is actually beneficial, especially for breast cancer. It's got genistein in it that's very therapeutic, and it's actually preventing cancer because it's blocking those high estrogen receptors and helping lower estrogen receptor activity in cancer cells. So for that reason, soy, if it's non-GMO, could be very helpful. So I wanted to spend a little bit of time there because that's something that patients are afraid of eating. So I wanted to mention that. Poultry and eggs. You want to remove the skin from meat, especially chicken, turkey, because they are higher in omega-6, and we want to lower omega-6 and increase omega-3. Omega-6 can be an inflammatory fatty acid. However, we do get omega-6 from seeds, and that's okay. Let's see. And then we have, there's some grass-fed meats, wild game, bison, lamb, and bone marrow. So marrow bones are very helpful, especially in anemic patients. Making bone broth could be very helpful, and it's very nutritious. Dairy foods, limit, again, I've mentioned this before. I want to keep mentioning this so I can kind of hit this point home. Limit, only use organic and fermented. So certain kefirs, yogurt are okay to use if they're organic. And then also some fermented cheeses might be okay. Popular one is feta if it's organic, that's okay. Alternatives, soy, rice, almond help. There are different kinds of milk products that are alternative to dairy that you can use, especially for as creamer, or some patients like to use it with their cereal. Those are the alternatives you can use. Best foods to eat. I kind of summarize some of the more therapeutic foods here. Soy, flax, rosemary, green and oolong tea, fish, curry, almonds, berries, pomegranate, apples, onions, garlic, mushroom, cruciferous vegetables. Some of these foods have sulfur compounds in them. They have the mushrooms boost your natural killer cell activity. Garlic it has sulfur in it. It's really good for your immune system. Apples, pomegranate, berries. These are foods that give you the proanthocyanins I was talking about. Berry and pomegranate juice, if it's naturally juiced, you didn't buy it processed with sugar in it, can also help strengthen your blood vessel walls. And this is important because, if you have cancer diagnosis, you're always being poked. Veins become extremely important. You need to protect your veins. Use arnica on them if they're being bruised often. You always want to protect your veins. And this is one food source you can give to your cardiovascular system. One thing I didn't write down here, because it is really in a form of supplement we use, is hawthorn berries. Hawthorn is also cardioprotective, and they can also help the blood vessels. So that's another one. I actually, in my office, I carry hawthorn solid extract. It's like jam. Patients say it's almost like my dessert I have all the time with my coffee, and it's extremely beneficial, and it's medicine. It can also lower your blood pressure, sorry. And then here on the next few slides, these are most common conditions that patients ask support in during cancer. So I've written down certain things you can take, nutraceuticals or botanicals, that could be helpful. So supporting sleep, melatonin, I mentioned the dose here because that's not a common dose. If you notice, if you go to the store for sleep, a lot of formulas have about 3 milligram dose, but 20 milligram not only helps with sleep cycle, but it also helps your immune system. So it's you're taking one supplement, one pill at bedtime, but it's helping two things. And again, I've mentioned this before, I'm mentioning again, you want to keep your immune system at optimal function all the time. So melatonin is really good for that, and it can help you with sleep. L-theanine also is anxiolytic. Glycine is another one that's anxiolytic. 5-HTP helps with sleep. It's also helping against depression, so it's antidepressant. These are some botanicals that are very relaxing. It can also slow down rapid heart rate. Heart palpitation is a very common symptom, both with anxiety and also chemotherapy induced, because some of these drugs are cardiotoxic or they're toxic to the heart. So these are some of the herbs that can help with sleep and for that. Stress management. This is huge. I think this is it's so important, managing stress. It's hard to say. It's almost like an oxymoron. We give you diagnoses that's actually life-threatening, and then we say, hey, manage your stress, lower your stress, right? It's really tough to deal with. These herbs could be very helpful. I always say, take control of your health, take it back again, even though that was taken away from you from your health. You want to do yoga or meditation or take herbs or have counseling, friends, your church, community, reach out to them. This is very important. When you lower stress, you start to heal better. You have a positive outcome and outlook in life. Hair loss is a big one. If it's chemotherapy induced, I always encourage my patients not to be stressing too much about this, because even though it is your identity, it's challenging you. Hair is a big part of us, of who we are. It will grow back. It'll grow back healthier if it's chemotherapy induced. Sometimes it could be because of anemia, so that's a little different. So managing that is important. And these are some of the nutraceuticals that can help with hair loss. Biotin, zinc. Zinc, you want to make sure you take it with food. It will cause nausea, and B vitamins also same. If whenever there's an opportunity, I mention that to make sure that patients are not even more nauseous. Taking these. Iron is another one. Again, anemic patients will have this issue. Fish oil, minoxidil is a prescription medication. I have them in tincture form. You can actually massage into the scalp overnight, and it seems to help with hair loss and also regrow hair back. Cryotherapy, this last one is during chemotherapy. It's hard to do cryotherapy for hands and feet, but it's easier for the scalp because we still have some hair left. But all you're doing is you're cooling down the scalp and lowering blood flow to the area, so you're not delivering that chemo induced blood that's coming to that area. You want it to go to the tumor and not to other areas, to the extremities, and that's part of the package when you're getting an IV. Anemia is another common one. This is a lot of times chemotherapy induced, or the cancer bleeds. Cancer itself will send signaling molecules in your body to make what we call dummy veins that are not well formed. They don't have all three layers to these blood vessels because they're rapidly formed. Cancer is very greedy. It wants to take all the nutrients and all the blood. So these dummy veins can easily rupture and bleed. That's why cancer bleeds all the time. So there are a couple of reasons why actually multiple reasons why anemia is prevalent in cancer. One is the bleeding. The other is chemotherapy can actually suppress the bone marrow. Third, you're not getting enough nutrients. You might be feeling lack of appetite or vomiting all the time. So for all these reasons, anemia becomes a prevalent condition in cancer. And these are some helpful therapies for anemia. I didn't write one thing down here I'd like to mention that really helps. That's shark liver oil. Shark liver oil or alkyl glycerol really helps the bone marrow make more red blood cells. And that could be something you can incorporate throughout your treatments. It won't go against chemotherapy. You can take it all the time. It helps with brain fog, and it can help your bone marrow make red blood cells. IV iron infusion. If I mention IV infusions, that's something I do offer here in the clinic. You can find them at other practitioners that may offer them. Just wanted to mention that. And then there's some conventional medications your oncologists may recommend, and I wrote down the names because those would be for anemia. Blood transfusion, I always say, should be the last resort. Even at the hospital, that would be the last resort. If they're giving you blood transfusion, that means you're so depleted of blood, it is probably affecting your heart function. Your blood pressure is dropping. There's not enough blood circulating in your body. So that's when that would be, but again, that would be last resort. Anorexia, cachexia. Cachexia means muscle wasting. This is another common one. The pendulum swings one or the other way. It's either there's overweight patients in cancer or really, really thin anorexic patients. So I address both these conditions. They're equally important for your overall health. Cancer will break down muscle. A lot of times patients start to feel weak during their treatments because muscle's being broken down for nutrients. And those nutrients could be, again, cancer is greedy, so it may take all these nutrients to it. Digestive enzymes can help digest your food and have the food's nutrition be available to your blood cells. So that's where digestive enzymes can become helpful. Maitake mushroom also helps with anorexia. Fermented soy, astragalus, IV vitamin C is very helpful. I also have IV nutrients I didn't write down here. If patients are very depleted, I will do a rehydration with nutrition, whether it's B vitamins or zinc or selenium or magnesium, potassium, calcium. These are nutrients that we can offer while you're going through a cancer journey. Cannabinoids can help because they can actually increase your appetite. And more food consumption can always help. Protein powders. We have a protein powder, a company called, I don't have any affiliation with them, but I do mention, I learned it from a cancer patient in the past. Mother Earth is the name of the company, and they make protein powder that it's I think vegan or vegetarian protein powder. We do have them in office here that seems to help put muscle mass back on. So that's something I always encourage. If I know a product helps, I'm happy to encourage patients to try that versus, blindly trying different products. And I will tell you, there are a lot of really good protein powders out there. I'm only mentioning what seems to be helpful. Fish oil is another one. Fermented wheat germ is a really good, it not only is antioxidant, it has anti-cancer properties, but it can also help during anorexia. L-carnitine is another one. L-carnitine is an amino acid that's also in red meat. And it's an essential amino acid, which means our body needs it, but we don't make it. So that's another one. And then modified citrus pectin. Modified citrus pectin also helps prevent metastases in cancer. So I tell patients to consume modified citrus pectin from the moment they know that their body is making dysplastic cells. And especially if you're having biopsy or if you're having surgery, you want to have modified citrus pectin on board in your protocol. It kind of works like a glue and binds your cancer cells together and doesn't let them migrate. And that's how that works. Cardioprotective therapy. Again, we talked about chemotherapy drugs causing damage to your heart. Milk thistle is cardioprotective. One of the reasons why milk thistle is cardioprotective is it helps the liver detoxify from all the toxic byproducts of the chemotherapy drugs, and that can help lower the toxicity level in your blood and indirectly helps protect the heart. CoQ10 is a really good enzyme. It works in the metabolic activity in your mitochondria to give you energy. That's another one that could be depleted. Also, patients that are on statin medications, they're depleted of CoQ10, and that's very important for mitochondrial support, which is, by the way, the organelle in your cells that gives you energy. It also helps the muscles work better, so it reduces muscle fatigue. L-carnitine, I talked about in a previous slide. Again, it's an essential amino acid. Notice 3 grams daily can help protect the heart. Taurine is another great one. I use taurine and L-carnitine in my IV bags for patients. Arginine is another one. Melatonin, again, is coming up here, 20 milligrams. It's also immune support, helps with sleep. So it has multiple uses. Astragalus is an herb that can protect the heart. It also lowers high blood pressure, which can happen with anxiety and high stress. It actually is an adaptogen, so it lowers the stress too. Glutamine is another one. It's cardioprotective. It also is protective of your GI tract. Curcumin is a strong anti-inflammatory, could be helpful in grapeseed extract. I also have curcumin and grapeseed extract or resveratrol in IV form that I give patients. Constipation is another one, especially for patients that are opioid painkillers. It's kind of a side effect of the drugs. Also with colorectal cancer, constipation or diarrhea, mostly diarrhea, but constipation could be an issue also. So maintain hydration. I've mentioned how much water you should be drinking, half your body weight. IV rehydration, something that could be offered here. Dietary fiber, also 25 grams daily. You can take, if you're having trouble consuming fiber, there's also odorless, tasteless fiber that's also does not also clump, so you can completely be soluble. That can help. You can add it in your coffee, for example, not hot but warm coffee, and it has digestive enzymes in it that could be helpful. That's dietary fiber. And then abdominal. Okay, so you also want to physically help massage abdominal area or exercises for that. Probiotics, specifically lacto and bifidobacillus, bifidobacteria, that could be very helpful for constipation. Yogurt, fermented foods, they're prebiotics for the good bacteria in your gut. This is one that's common. I use this all the time. Place a footstool in front of the toilet seat to optimize your physical positioning at defecation. This could really be a game changer with bowel movements, especially for patients that are suffering with constipation. 2 tablespoons of flax seeds or ground flax in smoothies could be very helpful. You can also just take your flax seeds and soak them in water and just chew and consume them. That could be really good as detoxifying your gut toxins and also helps with constipation. Sweet potato, 200 grams daily can prevent constipation. This is the iffy because sweet potato is really high in fructose, so I want to kind of lower that. I prefer, and prunes are another ones, but just be mindful about that. Magnesium, 400 milligrams before bed, 2 to 3 times daily also. I have a product called Mago 7. It's got ozone and magnesium in it. It's been phenomenal for constipation. Vitamin C, 3 grams a day could also, I always say to bowel tolerance, because you also don't want it to be too loose. So you can increase your vitamin C level until you start to have loose bowels. Then you know that's your threshold. Cascara is a cathartic herb that could be helpful, or aloe, whole leaf extract, or senna tea. Senna should be your last resort. It should not be your go-to herb for constipation, because there's been some supportive research saying that it changes the color and the consistency of the gut tissue. And so if that's happening, we want to be careful with senna. And also senna, there should be, you develop codependence, so you kind of want to be careful about that. I know there's a lot of information. I'm really sorry. I'm trying to get through them. It's helpful. If it's too much, maybe someone can unmute and say to pass them. But I do think these are very important. I'm going to go through them. Let me know. Depression, anxiety. This is big. Regular exercise is extremely helpful. Yoga could be very helpful. Adaptogenic herbs, ashwagandha, rhodiola, acupuncture, L-theanine, 5-HTP. These are very, very helpful. One thing I forgot to mention here is meditation. Meditation also helps kill cancer cells too. There's plenty of research that's coming out right now at UC San Diego. The research, there was a big project that was done with Dr. Joe Dispenza, who is one of the biggest meditation gurus, and they're saying even remote meditation, having people meditate for you and with you, could be extremely helpful, not only for depression, anxiety, but also for cancer, to put you in remission, also keep you in remission. Diarrhea is another one. This is more common again for colon cancer or during radiation or chemotherapy. This could happen. Here's some recommendations for it. Charcoal if it's for infection, and also bentonite clay or natural clay. You'd want to take it away from medication because those are binders. They can bind and reduce the effects of medication. Bismuth salt is a conventional therapy. You can actually buy that at a pharmacy and use that. Another thing, again, IV rehydration could be helpful for that. Sometimes patients come in so wiped out with diarrhea that IVs can be helpful. Fatigue is another one. Check for anemia. Blood draws can identify it very quickly. So nutritional deficiencies, iron, especially B12, folate, those could be helpful for fatigue. Infections, a lot of times during chemotherapy, it's easier for you to contract infections, especially urinary tract infections. And sometimes it's not so evident because everything hurts or you're always tired. So you want to make sure you screen for those, especially if you're having frequent or abnormal urination. You want to make sure you catch that. Mood or sleep disorders could be a good reason for fatigue. Sedating medications, this is common, especially with painkillers. Chronic pain can cause fatigue, hypothalamic, pituitary, adrenal dysfunction. I'm mentioning these so you can screen for them. And here are some of the treatments for fatigue. I've had patients really perk up after IV vitamin C. Also, IV ozone therapy. Like I said, I do offer a lot of ozonotherapy in my office, and it is a #1 therapy for fatigue. It's easy to do. There's no complication with it. We've had no problems with it. And it has anti-cancer properties. It's got immune supportive properties, anti-septic properties. So it's a great IV therapy for fatigue. And these are some of the things you can do on your own for it. Acupuncture is great. And let's see. And this is just some vitamins and minerals and nutrients. I wrote down some of the important nutrients that your body needs during cancer, and then the foods which can be rich in those nutrients. And that way you're not always focusing on capsules. You can actually change your diet or increase your dietary choices to include these foods. Let's see. So magnesium, potassium, selenium, zinc, flavonoids. So these are immune supportive nutrients. Essential fatty acids, I can't tell you how important it is also for brain health. So then here's some omega-3 versus omega-6 fatty acids. You want to increase omega-3, DHEA, and EPA fatty acids that you're going to get from fish or plants if you can't have any animal protein or fish as protein. There's much research available in consuming omega-3s to prevent and treat types of many cancers. And then this is a summary of foundational diet plan. So you want to eat adequate amount of protein. I wrote down based on your body weight, how to actually calculate how much you want to do per day. So it's 0.45 to 0.9 grams per pound you want to calculate. Eat 7 to 10 servings of fruits and vegetables. Drink half your body weight in fluids, especially water. You want to increase your omega-3 fatty acids, fish, flax, nuts, and seeds. Avoid simple sugars, refined carbs. Eat organic and unprocessed foods. You want to eat only wild-caught fish. This is really important. So a lot of times farm fish is being fed the same cornmeal we were talking, and now they're kind of contaminated with all the foods you're trying to avoid to eat. Consume at least half a cup of brassica family foods, phytoestrogenic foods, soybeans, what we talked about, non-GMO, and also a lot of the legumes are very helpful, and they're also rich in protein. Avoid saturated fats and trans fats. Use dietary supplements. Reduce or eliminate alcohol. Limit fast to 30% of your total calories. And then I think that's that. This is my information here. If you wanted to contact me, when you contact us, we'll have Megan, Connor, or Lily that will be answering calls. Sometimes, occasionally, I will answer the phone. You can also set up a 15-minute complimentary consult with me and see if I could be a good resource for you while you're going through your journey. And I'm going to kind of leave a few minutes for questions and answers or comments. So feel free to unmute yourselves and let's have a discussion if we need to. And thank you again, Rachel. Thank you again, everyone, for inviting me to have this talk with you. I really, really enjoy giving these talks, and I know that how much it could be helpful when you're kind of in a dark and you don't know what to do.